how much of a child's oral health, so their predisposition to cavities or just oral health in general, is determined by genetics, and are there factors that make some children more prone to cavities than others?
So when it comes to genetics, there is a large component of cavities that is genetic. So if our parents have cavities, we might have a stronger likelihood of that. But again, early on in childhood, there is a genetic component, but we want to try to counteract that with what we can control, which are the habits, diet, behavior, nutrition, those kinds of things. Something that I think every parent should know is early on when we're having milk constantly through the day and the teeth come in, it increases our likelihood of cavities. So what we can do to try to combat that, give some water afterwards, wipe the teeth afterwards, especially after that nighttime feeding. So I always aim and say this is progress over perfection. I like starting early with young kids, wiping those gums, brushing as soon as that first tooth comes in. It sets a stage earlier for desensitizing your child to getting used to it as part of the routine. But I have a toddler now and he fights me with brushing his teeth, and we still do it. Don't drive yourself crazy and think in this like binary way. If I don't do it, it's the end of the world. It's not, just, small habits over time.
Hello and welcome to the show. Today's guest is Dr. Ashley Lerman. She is a pediatric dentist and currently a pregnant mom with a passion for helping families foster healthy relationships with their dental health starting from infancy. Her mission is to empower parents with the knowledge and tools to ensure their children grow up with healthy smiles and overall well-being. Thank you so much for joining me today, Dr. Ashley.
Thank you so much for having me. Your page, presence, every social media has helped me so much with my current almost 16-month-old. And, I know it'll be helpful for my next child too, who's due in a couple of months.
Yes. Well, likewise, I love meeting colleagues on social media that, share this sort of love for education. And obviously, as a pediatric dentist, you are very much needed for me as well, because all of my patients need a strong pediatric dentist to educate them. And tell us a little bit more about yourself for anyone who may not be familiar with who you are.
Definitely. So I'm a board certified pediatric dentist. I came out of residency, went to my first job. I was seeing between 60 and 80 patients a day.
Oh,
I saw this
yeah.
massive pain point. It was wild. Felt like I was a broken recorder repeating the same things. And a lot of parents were disheartened seeing, their 3 or 4-year-olds having cavities. So I felt, pressure, especially in this day and age with the access of internet and outreach, to create a better solution. So I started my company First Grin, which is a public health initiative for maternal and childhood outreach to try to solve the problem of cavities. It's obviously a huge problem. Kids' number one chronic disease, sets the stage for adult teeth. But really just making these, routines, tips, and information tangible early on. So I do that alongside some clinical work as well.
Oh, I love it. And I think it's so important, like I said. And what we're talking about today are surprising factors that impact your child's oral health. I know you just mentioned, you started First Grin. It came out of being overworked, seeing so many things, the broken record. I have so much relatability to that because that's why I started Peds Doc Talk. And so when you think and educate families, I'm sure we'll go over some of these broken record things, but some people may not know that there can be an impact to their child's oral health, the things that they do, the things, maybe the genetics that they have. So let's first talk about genetics in a little bit. How much of a child's oral health, so their predisposition to cavities or just oral health in general, is determined by genetics? And are there factors that make some children more prone to cavities than others?
Yeah, I think that's an amazing question. Just to highlight your point, a lot of people aren't told these things early on enough. So
Yeah.
that's our goal. I think what you do is public health as well, and just making that information digestible. So when it comes to genetics, there is a large component of cavities that is genetic. So if our parents have cavities, we might have a stronger likelihood of that. There are a lot of twin studies that show there's a strong genetic component as well. And then aside from just genetics, if we have other, systemic things going on like acid reflux or bulimia later in teenagehood, we have to think about the rest of the body and what's going on. So if we have an acidic mouth, we may be more likely to have cavities. So making sure we have that full rounded perspective and knowing that cavities can be secondary to other things going on in the mouth is really important. But again, early on in childhood, there is a genetic component, but we want to try to counteract that with what we can control, which are the habits, diet, behavior, nutrition, those kinds of things.
The reason why this was an important conversation to me is that I had posted a photo of me going to the dentist, and I've been cavity free for my entire life. So at the time of this recording, I'm 38 years old, and I do well with dental hygiene, meaning I brush, I floss. My husband, on the other hand, is like always brushing his teeth. Like he will brush his teeth after every meal. He's using flossing. He doesn't really use a lot of, maybe some mouthwash, but he's much more on top of oral hygiene, even though I am as well. And he has a history of a lot of cavities. So the conversation came up on my stories that I was like, there is this genetic component there, and there is some reality that some people can do so much. But I love that we're going to be able to dive into, what it is that we can do to create these amazing oral health for our children. But in terms of one of the big questions that came up on my social was this truth of the idea that can cavities be contagious or passed from parent to child? And what does this mean about sharing cups or utensils with kids? Should we not do it? Does it really just depend on our own predisposition to cavities? Or how would you approach that in education for families?
Yeah, I love that. And I think, I get asked that all the time as well. There are a lot of studies that show primary caregiver, so let's say mom in this case, if she has that cavity causing bacteria, it can be passed down to the child through kissing, through utensil sharing, through spoon sharing. Sometimes, if a pacifier falls on the ground, a parent will pop it in their mouth and put it in their child's mouth. There are a lot of
Mm,
cultural components as well. But that is true. So, what we want to do as parents and caregivers is be aware of our active disease in our mouth, making sure we're staying on top of it. Because cavities aren't binary. It's not yes or no, there's a
yeah.
range. And if we can control that bad bacteria in our mouths, we can decrease the likelihood of passing that down to our kids.
And you mentioned obviously that bad bacteria can be increased by acidity in the mouth, right? Mentioned like acid reflux and all that. Are there
Mhm.
any other things that can increase that bacteria presence in the mouth besides acidity?
Yeah, so there are a couple of things. When it comes to acidity in the mouth, our mouth actually gets acidic after every time we
Hmm.
eat or drink anything besides plain water. So, something that I think every parent should know is early on when we're having milk constantly through the day and the teeth come in, it increases our likelihood of cavities. So, what we can do to try to combat that, give some water afterwards, wipe the teeth afterwards, especially after that nighttime feeding. So,
Mm.
that's why you may hear, ideally don't put a baby to bed with milk. Be realistic about it. If you are exhausted, we want to have a balanced approach, not have any judgment when it comes to that as well. But just know that long term it can damage the teeth if teeth are constantly exposed to sugars, anything besides plain water.
Well, I love that you just mentioned that this is not a judgment zone, right? I mean, all of this
Yeah.
is education and trying to really make the best outcomes for the family. And I really do find that sometimes when, you said it perfectly, whenever we try to educate and say, hey, maybe be more mindful about the bottle propping or the feeds right before bed, it really is just to look out for the best interest of oral health and the health of a child. And like you said beautifully, sometimes you're going to forget, and it's not the one off, it's the is this a consistent thing? And so
Exactly.
that's exactly how it is for me too as a pediatrician.
I mean, I think that's so important. Like the balanced approach, you talk about it all the time with parenting. And we have parents come all the time saying they felt shamed by their previous provider. That's
Yeah.
not my goal whatsoever. It's to give you the tools to use them how you see, fit best with your kids. You know your family the best. And like you said, a lot of parents don't know these things when it comes to dental or oral health. So that's my goal to make it non-judgmental, non-shameful, and, approachable and practical.
Yeah, and going into that area that can feel shameful is diet and nutrition, right? So you talked about obviously milk and bottles before bed, but how do diet and nutrition impact a child's oral health? And are there specific foods that are better or worse for teeth, and how so?
Yeah, so I think that's an amazing question. Diet and nutrition play a huge role. We hear a lot about candy, we hear a lot about sodas, sticky things that we want to avoid. But what it comes down to is actually just anything that breaks down to a simple carbohydrate. So that might be crackers, pretzels, salty things too that we may not stereotypically think of. And then when it even further than that, it's more about frequency. If we're eating and snacking through the day, the
Hmm.
mouth doesn't have a chance to buffer. So in an ideal world, you want to have organized meals, not snacking frequently, and then choosing, you know, let's say fresh, not processed foods. Is that realistic for parents on the go? It may be expensive. There's so many other factors that we need to consider. Again, we could talk about ideal versus realistic. And I think that's when we need to, have this conversation. A lot of parents just don't know these things.
Yeah, you're right. And the other thing that people often get concerned about, or there's a lot of confusion about, is thumb sucking or pacifier use, right? Like the how does that impact oral development? Obviously, that's not cavity prevention, or can it
Yes.
impact cavity formation?
Yeah, so we hear a lot about, habits like thumb sucking, using the pacifier. My son loves a pacifier if he still sees it.
Yeah.
Guidelines say ideally to stop it before age 3, but we even say start weaning around 6 months, trying to take it away fully by 18 months. Again, with a balanced approach, if you need to use it in emergency situations, if you have it on hand. I know my husband and I were traveling and we got massively delayed right around nap time. My son was losing his mind, and I always keep an emergency pacifier on hand. And it was perfect. It worked really well. So I think to give parents those tools is important. It can affect the teeth long term in terms of shifting the teeth forward, pushing them out, making the palate a little narrow on top. What that can do with the adult teeth is actually increase trauma risk to the adult teeth too long term. So
Mm.
there may be these early habits early on that may have resounding effects. But it's one of those things where I don't want parents to drive themselves crazy. If your child needs it to soothe, then I'm all for it.
Yeah, and I love the approach of the 6 months and 18 months. That's exactly, obviously, I'm happy to hear that a pediatric dentist is saying exactly what I was saying, because I do know sometimes we say, okay, it can be 2, 2.5, and I get it, like you said, that there may be some cases that you're like, I can't let it go, and I'm like, I know we can do this. I know we can get it
Yes.
off by 18 months, and especially starting the process at 6 months with like going to sleep time is very possible. And if you wait longer, it's harder to remove things that they get accustomed to, as we know with all children.
Definitely.
Yeah.
Definitely. And I also think there's a lot of parental fear involved too, because
Yeah.
we have almost like this use that always works and can soothe them. And then kids end up being a lot more resilient than we may give them credit for. So I completely agree with you.
Yeah, and going back to the milk comment you mentioned, obviously bottles versus cups, right?
Mhm.
Explain to maybe parents why prolonged bottle use may be more harmful than prolonged cup use of milk. Like, I mean, obviously, we talked about brushing after because the milk in general stays on the teeth. But what about the prolonged actual physical use of a bottle?
Yeah, so there are a couple of things with, sucking on the bottle. It's going to have a similar effect as a pacifier in
Hmm.
terms of narrowing the jaw, things like that. But there are also studies that show that there may be increased cavity risk too, because with the bottle, we may pool the milk around the top teeth, especially for longer periods of time.
Mm.
So what you want to do is introduce an open rim cup or a straw cup around 6 months, gradually keep increasing it, and then wean from the bottle, at least from a pediatric dental standpoint, between like 12 to 15 months.
Yeah, love that. And I think thank you so much for adding that on, because I think sometimes I am seeing 2-year olds still using bottles. And I am like, I know. And the comment that comes again is, well, they're not going to be a baby forever. And I'm like, I get it. I know they're not going to be a baby forever. I
Yes.
know you're not going to have a 4-year-old walking around with a bottle, but I would love to get you to a point where we can really balance this oral health. And I know that they can do it. And a lot of it is, like you said, parental fear with the pacifier too, is that, well, they're going to be upset about it. I'm like, well, you don't have to do a cold turkey if you don't want to. It can be gradual, but we're trying to do what's best overall for the child. And I know every child is capable of drinking out of a cup, and it becomes a comfort thing, of course, right? Like we have kids who will take all other liquids from a straw cup or an open cup, but they're holding on to dear life for that milk in a bottle only, right before bed. And it's like, I know they can do it. We just have to remind them that they can do it, because sometimes they just don't want to do it.
Definitely. We hear that all the time, word for word, everything you just said.
And the other thing I wanted to go over is mouth breathing. Does that have a negative impact on oral health? And if so, how?
It's such a hot topic right now,
Yeah.
especially on social media. You see it left and right. For young kids, there could be so many reasons a child is mouth breathing. We want to consider adenoids, if the child has a cold, postnasal drip. When it comes to the mouth posture and tongue posture can affect ultimately the way the jaws develop and grow, as well as it can secondarily affect dry mouth. And when you have a mouth that's dry, you don't have saliva to buffer inside there, so you may have an
Mm.
increased cavity risk. If you're ever concerned about mouth breathing, definitely talk to your pediatrician or a pediatric dentist. We may make a referral to ENT, these kinds of things. We want to get the full picture and realize what the actual cause is. I will say there's a lot of stuff on social media about mouth taping. Don't
Yeah.
recommend
Thank
whatsoever. It can be
you.
really, really
Thank you.
dangerous. Yeah,
Mhm.
yeah.
Can you go
Just the
over if
risk.
anyone
Yeah,
yeah, if anyone's not familiar with what you're talking about, what is mouth taping look
sure.
like? Yeah.
Sure. So mouth taping is essentially what it sounds like. It's putting a piece of tape over your mouth to encourage breathing through your nose overnight.
Mm.
The reason that could be really dangerous is if you have obstructed nose, you could potentially suffocate. You just never want to put a child in that situation. In the grand scheme of things, the risks far, far, far outweigh the benefits. Talk to your providers about this if you're
Yeah.
concerned about it.
Yeah, I saw a video, not necessarily mouth taping, but a video of a child whose mouth was open, right? And then the video said, if you see a child like that, make sure you close it, right? So then I actually was like, no, this isn't. Let me talk about this. So I stitched it. I did like a stitch of a video, and I said, let's talk about mouth breathing. But the problem then was happening is that parents are going to be so overstressed looking at their child sleeping to make sure that they're not mouth breathing to close it when they actually are just going to open it back up rather than just going to get the mouth breathing evaluated and discussed with their pediatrician or pediatric dentist. And so I love the way you phrased all of this in that you were like, it could be, it may be, because it's not like immediate red flag for us. It's a big picture. Like you said, it's how is the child sleeping? What is the adenoids and tonsils looking like? What's the nose looking like? It's not a red flag all the way, but it's a curiosity pink flag, if you will. It's like, let's take a look and discuss. And so I really appreciate the way you approach that and the way you talked about that today, because that is something that I often get panicked parents about because of social media videos.
Exactly, exactly. It's the nature of the beast at this point. But like you said, encourage the questions, the curiosity. But like you said, if you see something, it's not necessarily an automatic diagnosis.
Yeah. And did I miss anything else or about the diet nutrition aspect or anything else that you feel like you're telling families as that broken record of ways that, habits that they're doing can negatively impact oral health that we may have missed?
Yeah, I think when it comes to diet nutrition, the main thing is the frequency aspect.
Mm,
People just don't realize that. But also for, let's say, a little bit older kids, something that's often overlooked is the effect of seltzer. So
very cool.
seltzer can also make the mouth acidic. It has carbonic acid. That's what makes it bubbly. So it can make the mouth acidic. So treat it just like anything else other than water. So have a plain rinse of water afterwards. Be cognizant of not sipping it through the day. I know I'm so guilty of that before learning about this whole concept in dental school. And it really could put your teeth at risk. So this can be helpful for parents as well.
Exactly. I was going to say, I was like, maybe I should rephrase this to say, not just for kids, but for us. What should I be doing differently? Are you, as a pediatric dentist, I know even during pregnancy, our oral health changes. Is there anything that you change when you're, since you've been pregnant with your oral health, or are you noticing like more sensitive gums or anything in general in your pregnancy?
Yeah, so for maternal oral health, obviously a huge passion of mine goes hand in hand with
Yeah.
firstborn as well. There are unique challenges with hormonal changes. Your gums may bleed more, previous fillings may be more sensitive. One thing I want to make super clear and super important is going to the dentist for your routine checkup and preventive visits is so important. There have been studies that show possible correlation between maternal or mom's gum health and baby's outcomes, so fetal
Mm,
outcomes as well. So low birth weight, preeclampsia, because ultimately it comes back to inflammation or bacterial overload in the mouth. So we want to make sure that's handled. Again, full body care is what I'm so passionate about, comprehensive care rather than looking at system by system. Being pregnant now, I just make sure to floss a lot. I went to my dental checkup, and then for you know parents who are pregnant right now and wondering, it's safe at any trimester to go get your dental routine checkup and cleaning. um, Other than that, usually if you do have dental needs, it's generally recommended to get it done in the second trimester.
awesome. No, I remember when I was pregnant with both children, how sensitive I was. my gums were just very sensitive, and I would never really bleed or anything like that, but it was just very much more sensitive. And I'm going to
Mhm.
admit, and so let's all be real here, I did not go see a dentist with my second pregnancy. I have been very vocal about being not a good rule follower and a good example. And so don't be like me and make sure you go see your dentist, because I did not go in the pandemic, and then I didn't go for 4 years, and I'm ashamed to admit that. Thankfully, I was fine, but going back to the luck of the draw with genetics, I do not want us to take that chance. So go see your dentist, take your children to go see their dentist. It's really important, and I will not make that mistake again. But I wanted to put that disclaimer because I did not follow what I did not practice what I preached as for myself.
I love that, and that's fair, and it's like it's everything that we do. I
Yeah.
put my baby to bed without brushing his teeth too.
Yes,
Like, it's
yes.
okay. Zero judgment, and also I bow down to you for being so low risk, and I'm so impressed and blown away by that. I think
Listen,
that's
I it
incredible.
was so funny. They did an X-ray, and I was like, they said that they thought they saw a cavity on the X-ray, and I can't remember the term he ended up using. So the person, I think it was the hygienist before, so she saw it, and I was like, okay, and then I was like, oh, my streak is over, oh, and then the dentist came in, and I cannot remember the term off the top of my head, but he's like, oh, it's not a cavity, it's something else, nothing to be
Mhm.
concerned about, and I was like, oh. Amazing. So I'm like, my streak is still there. He's like, yes, your streak is still there. And I was like, yes. I was like,
That's incredible. You actually
I
deserve a medal for
I
that.
am so I it's one of my fun facts at parties. I mean, it sounds really
I
lame,
love
but
that.
it's a fun fact. I mean, it's really rare to be 38 and have no cavities your entire life. And obviously I do take care of my teeth, but not like obsessive like my husband, who looks at me out of the corner of his eye, I'm sure, and is like, "Why? Why do you have this luck?"
Side-eyeing you.
Yeah, and I don't. So, what are the most important things parents can do at home to ensure their child's oral health? And I know you already discussed obviously some foods, but maybe just kind of summarize the big take homes that parents should do.
Big take home is I always aim and say this is progress over perfection.
Hmm.
I like starting early with young kids, wiping those gums, brushing as soon as that first tooth comes in. It sets a stage earlier for desensitizing your child to
Yes.
getting used to it as part of the routine. But I have a toddler now, and he fights me with brushing his teeth, and we still do it. And I hear all the time parents come in, they're concerned about, stressing bodily autonomy, and they want to make sure their child feels safe and they're fighting them. So they have this push pull. And I think you might have mentioned it once, but I see it all the time too on social media where we as parents have to set the stage for some non negotiables when it comes to health, when it
Yes.
comes to safety, right? Changing a diaper, your child might be doing the alligator roll, but we still have to do it, right? Putting them in a car seat, they might be fighting and kicking, but we still have to do it. So for us to reframe dental health, oral health that way can be helpful for us as the adults in the room as well.
Absolutely. I mean, there was a video of another pediatric dentist or a dentist who was putting their child in the hold where you're sitting on the ground and your legs are lightly covering, over the child's
Yes.
arms, which is a very good hold. I'm sure I actually have it in one of my courses. Is how I had to brush Ryan's teeth, my son, because he was a fidgety little boy. And I mean, now he brushes his teeth happily, but yeah, we had to sing songs, put him in that hold, talk to him while I have his hand in my, his head in my hands, brushing, brushing, brushing. And my daughter, by all the luck in the world, will literally just walk to the bathroom, get on the stool, and stand there and wait and open her mouth for me to put the brush in. I mean, you're always going to get, I guess, one of each, but
Totally.
I have been there, right? I have been there. That okay, I'll try the more easy way. I'll get them in, but you said it beautifully that hygiene and safety, these are non-negotiable boundaries. Like I use the example of hand washing. There is no, I don't want to wash my hands. It's going to happen. So the options are you can either go there yourself or I'm going to help you there. And same thing with brushing, right? I'm going to have to help
Exactly.
you. And I know you've mentioned this too. Like children, even if they say they can do it, they don't have the dexterity to get back
Exactly.
into their back teeth until they're what, like 8 years old. So you're going to have to follow up, even if you're strong-willed 4 year olds. Like I do it. I do it all. I'm like, I know you can do it, sweetie, but I'm going to help you and I'm going to take a look and see how good you did. That's kind of what I say. And then I get back into those back teeth and make sure that he did a good job, you know?
Exactly, taking turns, and by the way, just to mention my son is the same way. We do that exact hold. I saw that. It was, the reel you referred to claiming that it was a traumatic position. It's not
Yes.
traumatic. It's just giving you the best view, and you could take turns, lots of praise, positive reinforcement, those kinds of things. But I totally agree. And One last note to add on, the same goes for flossing, using floss pickers too. I know parents look at me like I'm out of my mind because brushing can be a rodeo in itself,
Yeah.
but often between the teeth is where cavities start, and the toothbrush is just too big to clean in between those nooks and crannies. So that position as well can help you, especially flossing the back molars, which are in the mouth between 9 to 13 years old, and we see cavities start there all the time, all the time.
Yeah, flossing, you're right. It's one of those things that you're like, you spent the 2 minutes or whatever brushing, and then you're like, "Really? I
Yeah,
I
exactly.
now need to get into a fine crevice to put
You're
this
like,
in and out?"
"Absolutely not." Yeah, I hear it all the
Yeah,
time. I do it with my son. I'm like, "What are we doing right now?" And
so funny.
again, forego it if you can't handle it that day. But again,
Yes.
progress over perfection, consistency. Don't drive yourself crazy and think in this like binary way. If I don't do it, it's the end of the world. It's not. Just, small habits over time.
And then I know, we could do a whole episode on fluoride, but in terms of toothpaste choices, I know you recommend, like, a fluoridated toothpaste for when you're starting to brush, or what's your kinda recommendation on fluoride toothpaste?
Yeah, absolutely. Get this question all the time. So you can introduce a rice or smear size amount of fluoride toothpaste as soon as that first tooth comes in. You could bump it up to a pea size amount once a child turns 3. This effect that remineralizes the teeth is going to help, especially if we are eating solids, liquids, and just protect those teeth ultimately from cavities.
I'm feeling like really nice teeth health right now. I am loving this conversation. I really appreciated this. And I really loved, my biggest take home that you said to me, which was about the snacking, right? The fact that when you're snacking a lot, you're not giving your mouth a time to reset. That was so valuable. And I think with children, sometimes we can get caught up in that, especially because a lot of their snacks can be frequent if we're not setting kind of routine. And the choices of snacks, like you said, carbohydrates, sugars, all of that, but the snacking comment is such a good one. So thank you for all the wisdom you shared today about, setting a great foundation for teeth and all these unknown things that maybe parents didn't know about that can impact their child's oral health.
Of course, and if anyone has any questions, pop over. I'm so open and receptive and again, non-judgmental because trust me, I've heard it all and I want to make sure you feel comfortable with these questions. It's better to ask and know than just wonder.
Yeah, and where can everyone find you to stay connected?
So my social media is at pediatric dentist mom, and you could also follow along at First Grin for that preventive oral health information.
And I will be linking that information on our show notes so everyone can follow Dr. Ashley along and get her information and all of her resources as well. And what I like to do on this show is ask all of our guests a final uplifting positive message for everyone listening today. And this is so that we can always leave the conversations feeling better about ourselves as parents and feeling more motivated to tackle all the challenges we do. So what would be your final uplifting message for everyone on the show today?
I love it. And I mentioned it a few times already, but I just think progress over perfection, not just when it comes to dental health as a parent, in your career, in your day-to-day life. Keep moving forward. Some days are really, really hard. Trust me, I get it. Be kind, be understanding. And I really, really feel like with your channel and being a mom, a parent, gathering resources and sharing that wealth of information is making everything a better place, a little bit easier for everyone. So I'm glad to help contribute it in that small way that I can.
Oh, I love that part of the show. I love when I feel so motivated when I hear my guests share that, and it's so true. And I love that progress over perfection in every aspect of parenting. Thank you so much, Dr. Ashley, for joining me today.
Thank you for having me. Really appreciate it.